Well, good afternoon, good evening, and back around the globe to good morning. Welcome our audience from wherever you're visiting with us here today. My name's Tanya McKinney, and I'm the Chief Innovation Officer for our TCS Salesforce practice. Here with me today is Brian Cahill. He's with Humana. He's the segment CIO head for pharmacy. And then we also have Aaron Sanando. He's VP of Commerce Cloud at Salesforce. We're going to have a short time here today to talk about a really big idea and big project, and that is a HIPAA-compliant cloud-based e-commerce solution that we did together at Humana. So I'm going to turn it over to Brian right now. Kind of give me an idea, Brian, about Humana, what you do there, and sort of the genesis of this project.
Thank you, Tanya. It's always a pleasure for me to get together with peers in the industry, talk about a successful program that we've launched together. Humana is a health and wellness company, and we're headquartered in Louisville, Kentucky. We're one of the nation's largest health services companies, and we serve members' needs from primary care, home care, hospice care, and of course, pharmacy. My focus is in the pharmacy segment, and within that segment, we are actually one of the nation's largest pharmacy companies. We provide exceptional care for our members, which leads them to have their healthiest days. So that's been my focus within the pharmacy segment. And obviously this program that we've done with Commerce Cloud and Salesforce and TCS leads right into how do we provide that exceptional care.
So Brian, in this project, you were modernizing your e-commerce solution. And you had a goal, right? You're really re-envisioning a better digital experience for your members within the pandemic hit. And as we all saw, that really accelerated digital adoption. So tell us a little bit about the challenges you were facing and maybe how some of those challenges were altered or changed by this sort of the digital imperative of COVID.
Yeah, I mean, we would all be remiss to not understand that COVID has changed our lives. It came into the world and it's caused us to move more towards digital, a lot more people working from home, interacting online, and having different expectations about things being delivered to your home. And being in the pharmacy industry, that hits right at home for us because we're delivering medications right to patients. About a year ago, we were looking at a different solution for our digital assets. And so we evaluated this with many companies on how could we modernize our technology, have a cloud-based solution, and really advance within this digital space. So from a timing perspective, that was just more of a happenstance that it did align with when COVID started. We could not find really a HIPAA-compliant e-commerce cloud solution in the industry. So we took the stance of let's go create it. And with TCS's partnership and Salesforce's partnership, we did just that. We built that solution and successfully deployed that to production in the last 3 months, Q2 of 2021. And one of the reasons that we needed to do that is in this industry, we are growing. The use of pharmaceutical medications is growing. We're going to be continue growing over the next 3 to 4 years at exceptional rates. And we needed to have a solution that could grow with us, evolve with our members' needs, give us capabilities that were industry leading, but also be so secure that it passes that rigor, that high rigor and standards that both Humana, CMS, the government, and the industry expect from this type of interaction for our patients.
Thanks, Brian. Well, we were very honored to be a part of this. We were excited. We like big challenges like the first HIPAA-compliant cloud-based commerce site. It really involved a lot of key experts from our TCS team, the Salesforce practice, our industry practice, our Salesforce Commerce Cloud Center of Excellence. It all started with a road mapping out to help solve all the challenges you just laid out in front of us. But I think the real key there's a lot of technical challenges, right, around identity management, authentication. But the most important thing, as you expressed to us, was maintaining that seamless member experience across all the Humana businesses. It was a bit of a work. 50 plus enterprise systems had to be integrated into this Commerce Cloud environment for that. And Live Agent played a big role here in trying to create a seamless HIPAA-compliant interaction all the way through. I think there's two areas that really stand out to me on this, and one was analytics, because HIPAA changes what you can see and how you can use it, right? So Defining a way that analytics can deliver insights and still be HIPAA compliant was an important piece of the project, I think, for our team. And secondarily, DevOps. DevOps was key here. I think the team did a really good job of devising a new approach that married the Humana very stringent DevOps approach, which it must be, to the Commerce Cloud approach. We've sort of inherited that DevOps approach from retail arena primarily, and a new, DevOps approach that complied with the HIPAA needs was put in place. Now, what that meant was that during the project, we could get more features out in a timely manner. But more importantly, now that you're live, that you're going to be able to deliver features even faster. One of our commerce experts says, "Oh, Tanya, the real work starts when the site goes live. That's when most of the work starts." And I think that's what this DevOps, not the most exciting, it's not a really, beautiful UI, but I think DevOps is really key to the success of this project.
Yeah, Tanya, it's interesting that you say that, because when we talk about this project internally, we kind of compare it to we've reached base camp. If you think about climbing a mountain, there's a ton of work to climb the mountain. And what we've really done is we've actually reached base camp. And base camp means we've got all these other things now that we are at base camp that we can do and leverage the technology to really do for our customers. Now, it wasn't easy getting there. We've had multiple iterations of changes, 25 changes over the last 3 months as an example. And those changes aren't just bug fixes. Those are new features going out to members, new things that we are enabling for the members. You also mentioned the 50 interfaces or the interactions that we're doing with different systems within Humana. That's probably not typical e-commerce. And as you see e-commerce changing, we see that there is this need to share data and to do different things with data. And so we have a really strong and robust API integration layer that enables us to do these advanced things on our site, whether that's pricing, alternate pricing, suggestions for our members. All that's powered by APIs that very easily plug into this type of solution.
I was going to say, Brian, you mentioned this is like base camp at Everest, but you're the very first. we're the very first team that climbed Everest, and so, Aaron, obviously, Commerce Cloud has been the foundational part of this, but it's a very different project than, as Brian mentioned, that we would normally do, say, in a retail environment. So what's the future now for Salesforce Commerce Cloud in the healthcare industry?
Yeah. First of all, I want to say thank you once again to Brian and the team at Humana for really being a trailblazer, right, in this whole space, right? So we love, at Salesforce, we use the term trailblazer, right, quite often, is for those companies and individuals who really push the boundaries, right? And blazing the trail for others to follow, right? And so we're so excited to be in this project with you guys as we look to transform healthcare together with our partnership with TCS as well. So we see huge opportunity in the space of healthcare as well as wellness, right? We see during the pandemic, just myself as well, how many new sports equipment I purchased, to be healthy during the pandemic. We saw that industry booming as well during the pandemic, right? But we're seeing huge opportunities in, the concept of a do-it-yourself self-care, right? And also the role that companies like Humana play in the day-to-day wellness, right? And also increasing that personalized interaction with the members, right? And also driving a holistic care approach, and potentially not just for prescription drugs, but potentially for other things that could actually get that individual to be more healthy, right? It could be content around your diet, it could be content around workouts, right? It could be also potential recommendations of some additional benefits, of maybe it's a gym membership or whatnot, right? But we're seeing huge opportunities, and the commerce platform can really be the glue of that direct-to-consumer interaction platform, right? Our platform is flexible, it's API first, right? It's digital first, it's mobile first, right? And we see that as a huge advantage as we look at consumer behaviors change across the board because of the pandemic.
Well, as Brian pointed out, this is a very different kind of project, I think, than we normally see in e-commerce. So that means some different kind of outcomes. So Brian, tell us a little bit about the go live and some of the outcomes that you've been experiencing since this launch.
Yeah, since go live, we've also leveraged some of the capabilities of Salesforce and content management, but more importantly, validation/testing within the platform that can help us understand what the members want and customize and personalize the experiences for them. Some people call it A/B testing, cohort testing, but those capabilities are very robust within the suite. And we're leveraging those capabilities now to really understand post go live, what do members want to do? How do they want to interact with us? Do we need, a commercial member within this type of disease state, or somebody that we understand this about their health? Should they have a different personalized interaction than somebody else that isn't at that point in their life? And with this platform, we can actually understand that and then start to personalize based on that unique need of the member.
Aaron, it's interesting to hear somebody in healthcare talk about A/B testing.
Indeed. Yeah, I mean, these are vocabularies that we're seeing being picked up, right? Historically, is obviously a lot of it's been in retail, right? The retail space certainly does this a lot, and also the speed of the changes to the websites, layouts, and products, right? But we're seeing this appetite for much more direct-to-consumer approach across multiple industries. And again, largely because of the pandemic, right? And I feel very grateful to be in commerce because I feel I've gotten that front row seat over the last 18 months of just transformation, going from years to months and months to weeks, right? Of companies, experimenting with like, how do we go direct to consumer? How do we actually put in commerce as part of our repertoire in terms of our approach? If we've sold historically through stores or through wholesale distributors, how do we actually get direct to consumer, right? And a lot of industries had their products stuck in shelves when the stores and the malls, sort of closed down. And that kind of got a lot of the executives thinking about, well, how do we add to our strategy, right? It's not necessarily, replacing, right? But a lot of it's experimenting around new channels and new business capabilities.
Yeah, Aaron, you mentioned speed to market. I'd just like to comment on that. That is one of the key capabilities that we leverage out of the product. And with Salesforce's partnership is we have capabilities now that we don't have to go build and develop within IT. We can empower our business to really go and do those capabilities or implement those capabilities within the platform with a framework that allows them to do that safely. The other interesting thing that we get out of a Salesforce partnership is you have a marketplace. And there's others that have innovated with Salesforce on top of Commerce Cloud that instead of us going to build a capability, we can partner with you, we can partner with them, and much more quickly enhance the site and or capability at a speed much quicker than we could in the past.
100% agree.
Aaron, this seems a little bit different than the typical sort of retail e-commerce site. We are seeing more and more businesses like Humana, businesses that we don't always think about using e-commerce, are putting e-commerce to work for them through Commerce Cloud. To me, this is one of many areas of future industry expansion. I kind of dubbed this whole area uncommon e-commerce. So where is Commerce Cloud going to take us next in this uncommon e-commerce world?
Well, I certainly see huge opportunities across multiple industries, right? I mean, we're seeing it in healthcare here with Humana leading the way. But we see a lot of opportunities across automotive, manufacturing, comms and media, right? And also hospitality. If you look at how that industry, really got hit hard because of the pandemic, they're going to come back, right? So we're making big bets. And a lot of it is definitely learning from retail, right? Because retail is direct to consumer. They've always had that first party data, right? And a lot of industries are looking to learn and adapt to the speed of retail. And we're quite excited to be the platform of choice for the experimentation and the transformation.
Well, Brian, maybe we can teach retail some new language as well. And we can teach them to think about care, wellness, and membership as a way to think about customers. It's delightful to hear. I mean, I love these triumvirate of success stories where a client like Humana, TCS and Salesforce can work together to make your dreams become a reality. And thank you both for being here today, and look forward to doing more projects like this with you in the future.
Thank you, Tana.
Thank you, Tanya. Thank you, Aaron.
Thanks, Brian.